If you are thinking of traveling for your IVF cycle, whether it's for the egg retrieval or the embryo transfer, you are going to want to watch this video. I'm Dr. Lora Shahine. I'm a double board certified OBGYN and reproductive endocrinologist, helping people build families and do IVF for almost 20 years. And a common question and concern that patients have is it okay to travel around my IVF cycle? When can I travel? Can I fly? Can I not fly? Just so many common questions and concerns. And so we're going to go over each one in this video. There are 5 main topics that we're going to cover. Number 1, flying and fertility treatments. What's the worry? Like, why are people worried about this? Number 2, flying or traveling while you're trying to conceive. What does the evidence show? Number 3, egg retrieval and travel, or flying specifically. Number 4, embryo transfer and traveling or flying. And number 5, we'll go over what I tell my own patients. And of course, you have to talk to your doctor and your clinic about your personal situation, but I'm happy to share what I tell my own patients. Topic number 1, flying and fertility treatment or trying to conceive. What is the worry? Well, people worry about anything that might impact their chances of getting pregnant. You know, when you are struggling to conceive, you are investing time, resources, money into a fertility treatment. You want to think of any variable you can control to improve the chances of success. And you certainly don't want to do anything that would harm or decrease the chances of getting as many eggs as you want or having that embryo stick after an embryo transfer. So people worry about flying with air pressure changes. They worry about the stress of kind of running through the airport to try to catch that flight. People worry about dehydration on a plane. What about travel in the time of COVID and viruses and kind of catching something on the plane, you know, kind of in a confined place? So there's lots of reasons that people worry about traveling or flying during their fertility treatments. And it's okay to have these worries. And it's really important to make sure that your questions are answered by your clinic. Topic number 2, traveling and fertility care or IVF. What does the evidence show? Nothing. There's not evidence. I couldn't find a single study in the literature looking at flying after embryo transfer and success, or when to fly after an egg retrieval, like when is it safe? So these are common questions, and it's just not something that's been studied in a controlled fashion, written up in a journal and shared in a scientific way. So the recommendations are really coming from decades of experience and personal understanding. There's not really good evidence. The only thing that I could find when I was looking up flying and fertility or flying and IVF there's a lot of studies that look at different professions and chances of infertility or need for fertility treatment. I don't know if you know this, but being a doctor is one of the biggest risk factors for having infertility. 1 in 6 people in the general population has infertility, but 1 in 4 doctors, including me, has infertility. And it's hard to know exactly what that is. I think it's a combination of a lot of things, but a lot of studies have looked at different professions and incidence of fertility issues. And there are some studies that have looked into what about flight attendants, flight attendants, airline captains, people flying for a living, and does that impact their fertility or miscarriage rate? The worry can be, when you're up high, you're exposed to cosmic radiation. So every time we fly, you're getting kind of closer, or kind of exposed to different radiation. People worry about standing for a long period of time. People worry about how dehydrated the air can be on airline flights. And there's some worry about just shift work too, and constantly changing your sleep patterns, flying from time zone to time zone and trying to sleep, at a time that's not really what you've been used to for the last couple of weeks, throwing off your circadian rhythm, throwing off your hormones, throwing off ovulation. So there is some thoughts and worries about someone that is constantly flying for their job and going through all these different changes, and that might put them at a slightly higher risk of taking longer to conceive. But those are the only kind of studies that I could find that was associated with flying and fertility. It's more like a profession, not taking a single flight after your egg retrieval or after your embryo transfer. There's no studies that really give us scientific evidence to say exactly what we should and shouldn't do. So topic number 3, egg retrieval and travel. So things to think about with an egg retrieval is it is a simple procedure that takes about 15 or 20 minutes. There's no incisions on the belly. It's just a needle going under ultrasound guidance through the upper wall of the vagina into the ovary in order to drain the follicles, the sacs of fluid that have each egg. So it's kind of one puncture into one ovary, draining all the follicles, bringing the needle out, going to the other side of the vagina, going into that ovary, draining all the follicles and bringing the needle out. So it's a very low risk procedure. It's very unlikely for complications to happen, but just like with any procedure, there can be complications. And so the thing I think about with an egg retrieval is if you're going to have pain or bleeding or something that is urgent after an egg retrieval, some complication that's going to happen after an egg retrieval, it's most likely going to happen within the first 24 hours. So most of my colleagues, when I polled them and asked, most people say don't fly on the day of your egg retrieval, but fly the day after, kind of try to give it at least 24 hours before you get on the plane. Other things to think about is the egg retrieval. This is stimulating the ovaries. There's a risk of ovarian hyperstimulation syndrome. You're feeling bloated. Just that stimulation process, you're already significantly dehydrated. Please see my videos here all about ovarian hyperstimulation syndrome and the benefit of trying to stay hydrated with electrolytes and protein in the process to kind of decrease that bloating and help you feel better. But when you're flying, that's already such a dehydrated air system. You're already dehydrated. You're feeling bloated. So if you are going to fly after an egg retrieval, think about wearing really comfortable clothes. Think about staying as hydrated as you can. Hopefully it's not a very long flight. And just remember, if you're feeling really bloated and full, it might be really uncomfortable to just have that seatbelt on and kind of be sitting upright for a long period of time. So those are the kind of things to think about. Anytime you fly and you've been sedentary, your estrogen levels are high, you might be at a slightly higher risk of thrombophilia or your blood being more hypercoagulable or a blood clot. So you want to think about maybe walking around the cabin every hour or two, again, staying hydrated and just trying to be as comfortable as you can on that flight home. Topic number 4, embryo transfer and flying or traveling. This is usually separate from the egg retrieval, so you haven't just had stimulation and you're not feeling as bloated. Now, this is assuming you're doing a frozen embryo transfer. There are times where people do a fresh embryo transfer about 5 days after the egg retrieval. And so if you're flying after that point, you might still be feeling a little bloated and dehydrated, just like I was talking about with the egg retrieval process. But most people that are flying to their clinic for an embryo transfer are typically doing a frozen embryo transfer. They're far away from the fluid shifts that happen with an egg retrieval, and they're just going to the clinic for the embryo transfer. There is no medical or scientific reason or evidence to suggest that flying after an embryo transfer will impact the implantation or success of an embryo transfer at all. Theoretically, people worry about, air turbulence or being jostled around in the flight or kind of having a seatbelt on or being dehydrated or the pressures or kind of changes in things that happen with flying that might affect the ability of the embryo to implant. But there is no medical or scientific evidence that this disturbs implantation at all. So I get the valid concerns and the worries. I mean, this embryo, it's so precious. You work so hard for it. You want to be pregnant and add to your family or start your family more than anything in the world. And so it's okay to have these concerns and worries, but I just really want to reassure you that I tell my patients after an embryo transfer, you cannot do anything wrong. Definitely see my video here on how to recover from an embryo transfer and kind of post-transfer instructions, where I talk about that, you want to have self-care and take care of yourself. Tease, your partner if you have one, that you can't do any housework after the embryo transfer. You got to rest and relax. But really, people get pregnant all the time and they're not, actively changing their movements and their lifestyle because they don't know exactly when the embryo implants. It's different when you have an embryo transfer because it's so precious. So be, mindful, rest a little bit, do whatever feels right for you. But I just don't want people to worry that if they bend down to pick something up, or they twist quickly, that all of a sudden they've ruined the chances of getting pregnant in the embryo transfer. It's just not that delicate. Okay, topic number 5, what I tell my patients. What I tell my patients is if you are traveling here for an egg retrieval, Actually, they're typically coming for a few days in the last 1 or 2 monitoring visits before the trigger and the egg retrieval. So most of the time my patients are in Seattle for about a week. And I do tell them, don't travel the day of the egg retrieval. If you want to go home just as soon as possible, please travel the day after the egg retrieval and try to do it as late in the day as possible, so that if you have any of those complications like pain that is not controlled with the pain medication I give, or worries about bleeding, or just difficulty urinating, or just any of these things that are very rare but can happen, I would just rather you be in Seattle so that I can take really good care of you before you get on a plane and you go home and then you're trying to seek care at home. For an embryo transfer, I recommend planning on being in Seattle for 2 nights. I recommend flying in the day before the embryo transfer, and I recommend going home the day after the embryo transfer. So this is for a couple reasons. First of all, flying is just not that relaxing. It is actually quite stressful. And in this day and age where flights are overbooked and sometimes canceled, if you are traveling on the day of your embryo transfer and you miss the transfer because of a flight connection or a flight delay or something that's out of your control, it's just devastating. You have to freeze the embryo. You have to reschedule your transfer. It's just devastating. So coming in the day before the embryo transfer, you already know you're in Seattle. You have a relaxing dinner. You're maybe watching a movie in the hotel room or the Airbnb. Like, you're just kind of going at a nice relaxed pace. And then you show up in the clinic the next day. And after the transfer, if you really need to go home, of course you can fly that day. But again, it's just travel is stressful, and you're trying to go through screening, and your flight might be delayed, and you might miss a connection or whatever. So like after the transfer, just go back to that hotel or your friend's house or Airbnb and just have a relaxing evening, and then get on the flight the next day. That is what I recommend to my own patients. Now, here are some other important travel tips that I recommend to my patients. Okay, I've got 5 travel tips that I tell my patients as well. This is pretty specific to flying, but this is important. Okay, tip number 1, get a refundable ticket or a traveler's insurance or something where if you have to change the date or the time of your flight, you don't have a huge financial penalty. So if you are planning, it seems like on your IVF calendar that your egg retrieval is going to be on a Friday. Well, that could happen, but you know what? It's up to your ovaries, and they might decide it's going to be on Saturday or Sunday. So just be flexible. If you have to change your flight, just make sure there's not a huge financial penalty. Tip number 2, take your medications and be very careful that you've got what you need. Make a checklist and check it once, twice, 3 times before you get on that plane. And that checklist needs to include not only the medications, but any syringes that you needed, alcohol, swabs, pills, everything. And just, again, don't forget your medication, and don't assume, and just double, triple check your checklist. Tip number 3, traveling with medications, do not put them in your checked luggage. Luggage can get lost, and the temperatures on the airplane and the luggage bin are just really, really high or really, really low. It's just not well regulated. Keep your medications with you and carry them with you in your bag onto the plane and the cabin where you are sitting. If you're worried at all about going through TSA and security with medications and needles, get a letter from your clinic that just says, hey, I need this medication for my medical treatment. Most of the time, people are traveling with medications like insulin and things with needles all the time. It's usually not an issue, but if you're worried about it, just get that letter and you're going to have so much less anxiety as you're going through the security checkpoint. Tip number 4, wear comfortable clothing, especially if you're traveling around the time of your egg retrieval and you're feeling bloated. Just, really stretchy, comfortable pants and baggy sweatshirts are your best friend. And finally, tip number 5, stay hydrated. So that goes for any time during your IVF cycle, whether it's an egg retrieval, whether it's around your embryo transfer. Flying is just, the air is so dry. You want to really keep your fluids up and stay hydrated. It'll help you feel a lot better for your flight. I hope you learned something watching this video. If you are flying or getting ready to travel for your IVF cycle, you now have some solid tips to help you get ready. Make sure you like this video if you learned something, comment with questions that you have and topics you want me to cover, and subscribe to this channel so you get my weekly video all about reproductive health. As always, wishing you love, luck, and pineapples.